Hello, everyone, and welcome to the Arthritis Action Podcast. I'm Marc, your host for today, and for this episode, I'm joined again by Dr. Wendy Holden. So, Wendy is an honorary consultant rheumatologist at North Hampshire Hospital's NHS Foundation Trust, specialising in arthritis and pain management, and she's also the medical advisor for Arthritis Action. So, welcome back, Wendy.
Thank you very much. Very excited to be back with a very exciting topic.
Yeah, it's a good one today, isn't it?
Yeah.
So today I should probably tell you all what we're going to be doing. So we're going to be talking about hormones and how it can affect your arthritis and your body throughout your life. So, I mean, obviously I'm not an authority on hormones, but that's why I have Wendy here, who is, and she's more than up for the task. So what we're basically going to be doing, I think, is we're going to take you all on a trip throughout a timeline of a woman's life and the different hormones and the different changes it can make throughout the different stages of that. Does that sound good?
Excellent. Yep, I'm ready for that.
Excellent. That does bring me to another question, actually, before we've even started. Does this, like, when we talk about hormones as well, we usually think about it like it being a predominantly thing to deal with women, but does it affect men in any way like that as well?
Yeah, that's a really interesting question, Mark. So we know for sure that men have hormonal cycles as well, although obviously women have a 28-day cycle. Usually, men also have a testosterone cycle, and there is two main types of cycle that men have. So we know for sure that men's testosterone levels are highest in the mornings, and then they fade through the day. So there is a 24-hour type cycle there. And then there is thought to be a longer cycle, which is a bit more unpredictable, anywhere between 20 and 30 or 40 days, with the hormones naturally fluctuating, and that would vary from person to person. And it's also been theorized that if men are in a relationship with women that are ovulating and having hormonal cycles, in some men the testosterone can be synchronized with the female fertility, the main period when they are most fertile. In other words, when the testosterone will be higher to increase libido during the time when the women are most fertile for some couples, which is a really interesting thing as well. And presumably
Wow.
presumably the opposite would also apply.
Interesting.
Yeah.
Ah, I think I definitely need to learn more. Clearly,
Yeah. There's not much. It's not very well understood in men, but there are definitely cycles.
I mean, it feels like, in a way, like from everyone I kind of speak to, hormones in general are not well understood, just in general, by everyone.
Absolutely.
So hopefully we can shed a bit of light on that then. So
Yeah.
we talk, say, starting from like childhood to puberty, perhaps, and like how
Yeah.
the hormonal changes can be then.
Yeah. Absolutely. So in terms of arthritis, the
Mm.
main, I mean, people can get inflammatory arthritis at any age, as you already know. However, um, if someone with when someone with inflammatory arthritis goes through puberty, this can be a very turbulent time for the arthritis. And people who have inflammation in the joints often have slightly delayed puberty, especially in girls, by up to about 2 years. So they're slower to develop. We don't really understand why this is. And that's got some potential long-term consequences, in particular on peak bone mass. So when we are teenagers, we are developing stronger muscles and we are developing new bone, and through that time it's very important that we try and maximize our bone density, because that is important for later life in preventing bone fractures. So it can be a problem for people who have inflammatory arthritis going through that phase slightly later, which is again why it's important to control the arthritis as much as we can to minimize that problem. Now, I think what will generally happen to most women when they reach that particular age, that they will suddenly become aware that lots of things change in their body at that time. I'm not just talking about physical things, but things change in terms of mood, and you become aware of the effect of hormones on many things: your sleep, your bowels, all sorts of things. And similarly, there's a really interesting lot of research going on at the moment to do with athletes and their menstrual cycle, and everybody's talking about it these days to say, you might know a bit more about that, Mark, with your previous incarnation,
It is something I've read about
to do
before,
with
yeah.
fitness and exercise and things like that, and when should we be exercising. It's not very well understood, but certain times of the month will be better for building muscle, for example, and in other times will be better for resting potentially, and athletes often do peak performance days on certain days of the month, and less so on other days. So modern day Olympic athletes, for example, will be well aware of all of that and working with their cycle and their trainers to maximize their performance.
It's kind of like a make hay while the sun is shining kind of approach to it, isn't it?
Exactly. And I mean, it's not all bad news. It's about optimizing those times when women are likely to be at their best or their strongest.
Absolutely. So I suppose then the next thing, as so we mentioned puberty already, so menstruation then starts to become a factor in that, and I know that that can have a
Yeah.
big effect on your arthritis, especially. So I was wondering if you could tell us a bit about that.
Yeah, definitely. So I suppose I should just talk a bit about the what happens to the hormones during in general. It is a very complicated topic, but broadly speaking, the main hormone we're talking about to do with arthritis and pain is estrogen, and that's the one that women have high levels of estrogen. And estrogen levels fluctuate through the cycle. So broadly speaking, at the beginning of the cycle, the estrogen levels are low. In other words, when the bleeding starts, the estrogen is low. It will gradually rise for the next couple of weeks, and then it will peak around ovulation time, and then it will be dropping again towards the second half of the cycle. So what we know for sure is during the second half of the cycle, when the estrogen levels are dropping, women experience more pain, really from any source. But estrogen has a strong effect on pain threshold. So if you have joint problems, or if you have pain, or if you have any kind of pain, in fact, it's going to be worse during the second half of the cycle, and often at its peak worstness, if you like. That's not a word, but it's peak badness immediately before the period. So there is definitely a pain fluctuation through that time. And many women will also find that their sleep is a little bit disturbed during that time as well. And those two things are strongly related as well.
Does that tend to regulate the same as, I mean, I'm assuming it does, but obviously I shouldn't assume, so I thought I'd ask. But does that regulate the same as, like, as you can track your periods and then you can sort of like roughly know when certain things are going to happen? Does that then fit in, or is it a bit up in the
Yeah,
air?
yeah, absolutely. Yeah, that's a really interesting point. And women with inflammatory arthritis often report flares during that period, during the period, if you like, and immediately before. And that's often the way it goes, which is interesting.
So it'd be an extra layer of planning that you've got to do if you have something like
Yeah,
inflammatory arthritis.
yeah, exactly. Or just sometimes just being aware that that's where you are, and that this might be a bit more of a more of a painful day, and perhaps not to plan so much on that day.
Interesting. So we're going through a whole list of different sort of things that will happen throughout the life.
Yeah,
And one that unfortunately does come up a lot is breast cancer. So like
yeah,
that, of course, will have a
yeah,
lot of issues on your hormones and arthritis as well, I'm assuming.
yeah, yeah. So around about, I think the numbers are around 1 in 8 women, something like that, or no, maybe even higher than that, will
Wow.
develop breast cancer at some point in their lifetime. And unfortunately, for some women, though, that breast cancer is estrogen sensitive. And for those women who have estrogen sensitive types of cancer, in other words, cancer that grows if too much estrogen is around, they will be offered drugs that cut off the estrogen, basically. So drugs with names like tamoxifen or anastrozole will be drugs that are anti-estrogen drugs after they've had their treatment for the breast cancer. And what that does, unfortunately, is to put many women into almost an overnight menopause. So in most women, the menopause comes on over a few years and it sort of sneaks up on you. Whereas when you start the breast cancer drugs, it can often cut the hormones off straight away. That's what the treatment is designed to do. And that can cause many, many, many problems. And the drugs are not tolerated by quite a lot of people because of the instant menopausal symptoms, not the least of which can be joint pain. So, for example, at least 50 to 60% of women who are given those breast cancer drugs will struggle with joint pain for some time. It will often fade, but it can be a really big problem, certainly at the beginning. Just at the time when you don't want it, you've got the diagnosis of breast cancer, and then you've got to take medication regularly, and then you've got joint pain on top of that. It's no fun at all.
So what is it that actually kind of causes the joint pain then?
That's a good question. It's thought to be similar to the similar to what happens during the natural menstrual cycle. So when the estrogen drops, it reduces pain threshold, if you like. So in other words, things that should not necessarily be painful will hurt more. Which is not to say that women are wimps, obviously, but
Of
it
course not.
just
No.
means that no, you
It's,
wouldn't dare to say such a thing, would you?
no.
But it's just to say that if you're lacking estrogen, you won't be so robust, if you like, to pain. So things will hurt more. It's real pain, of course, but it doesn't hurt so much if you've got estrogen around.
So this one comes from a friend of mine who's
Okay.
she can't have hormone replacement due to other issues because I know, like, as you're saying, like it stops
Yeah.
your estrogen, and then
Yeah.
various problems come from there. So I know that
Yes.
hormone
Yes.
replacement therapy is something that people
Yeah.
then sort of do. So, I mean, first, actually, let's make this a two-pronged question. Can you tell us about hormone replacement
Yes,
therapy,
of course.
and also what you can do if you can't have hormone replacement therapy?
Yeah, that's also a great question because HRT now is extremely fashionable, and,
Mm.
and I think a lot of women feel guilty if they don't want or can't have HRT. Um, so first of all, what HRT is basically it's your own natural hormones given in an artificial form, and for most women that would involve some form of estrogen treatment, or for all women there will be some form of estrogen treatment. And for women who have not had a hysterectomy, they would also need some progesterone treatment as well. Both of those hormones are needed. If for women that have had a hysterectomy, they just need to have estrogen on its own. So most women would have both. And those are, it's really, if you think of the menopause as being a hormone deficient state, like having an underactive thyroid or having diabetes, it's quite easy to understand why you might need some hormone replacement. And the other thing to say about that is that, if you go back hundreds and hundreds of years, women did not live long after the menopause. So in a way, being postmenopausal is an artificial state. Yet most women will now live for 20 or 30 years into the post-menopause. And so having some HRT is often helpful for many women, and for many women there is a lot more to gain than there is to lose. However, you are quite right. For some women, HRT is not appropriate, and that in particular that would apply to women who have had breast cancer in particular, and some women with endometriosis as well, which is another gynecological problem that is estrogen sensitive. So all is not lost if you can't take HRT. So there are quite a few other alternatives if you don't want HRT or if you can't take HRT. All of these things have been subject to various Cochrane reviews or nice guidelines, and many of them do not stack up particularly well in some of the Cochrane guidelines. And I think that's because of the way that the studies have been done on some of these products. So, for example, estrogen is not just found in chemicals or medications. Estrogen can be found in some plants, and those are called phytoestrogens, PHYTO, meaning a plant. So there are plant estrogens. We know for sure that women in Japan, where they eat a lot of soy containing products, and soy is an example of a phytoestrogen, in other words, a plant estrogen. So in Japan, where they eat a lot of soy, for example, tofu and soybeans and things like that, and soy sauce, women do not complain so much of menopausal symptoms. In other words, they have far fewer hot flushes and things like that, which is really interesting. Now, studies have been done on soy products, and the results have not been brilliantly conclusive when you look at large populations of people. When you look at large populations, that really ignores the benefits on individuals. So the fact that it hasn't worked for populations does not mean that it won't work for the individual. And there are lots of smaller trials that show that things like eating more soy or eating other phytoestrogens, for example, red clover is an example of a plant estrogen, or black cohosh in particular, which is an interesting one, and that's a herb, the root of a herb that's been eaten by Native Americans for hundreds of years for dealing with menopausal symptoms and joint pains. Um, all of these things have now been shown in smaller trials, and in fact larger trials, to be beneficial for menopausal symptoms. Now, what they particularly work on are hot flushes, which are obviously a menopausal symptom for some women. However, if hot flushes are reduced, sleep is also improved. And if sleep is improved, joint pain is often improved. So it's not
Mm.
necessarily a direct relationship between plant estrogens and improvement in joint pain, but if sleep improves, pain will improve.
Well, excellent. I mean, well, as I say excellent, I know that sleep is a big issue for a lot of people as well. Like,
Yeah, there's a couple of other things actually that I forgot to mention. So there's St. John's wort as well, which is another herbal remedy often used for mild to moderate depression, can be used for menopausal symptoms. There's a Chinese remedy called Dong Quai, Dongquai, and evening primrose oil, all worth a try. With a little proviso with all herbal remedies, make sure you check that it's safe with the medication that you're currently taking.
mm,
In particular, St. John's wort, which has got lots of interactions with conventional medicine. And just make sure you let your doctor know what you're doing, because some things like black cohosh, for example, can be associated with liver problems. So we need to just make sure everything is completely safe. The problem with herbal remedies in the UK is that they are classed as a food substance and not as a medicine. And that means they're not subject to proper testing like medicines would be, which they are in countries like Germany, for example. Herbal remedies are classed as a medicine. So they're properly tested.
wow, I
Yeah.
didn't know that.
Mm.
One other question, actually, splitting us back to hormone replacement therapy.
Yeah.
How is it carried out? I mean, is it pills, injections?
Oh, yeah. Yes. Lots of different ways that you can have HRT. So it can be given by tablet, patch, or gel, rub on gel. Spray, there's a spray of estrogen. So some people can be sensitive to the gel. It can cause a rash, whereas a spray is a bit more less allergy producing potentially for some women. Yeah.
Okay.
Like a perfume, I suppose. Spray it behind your ears potentially. Rub it
Oh,
in.
so does it go on the skin, or is it like an oral
Yes, on the
spray? Yeah.
skin. Yeah, on the skin. Yeah, absolutely.
I was just picturing like a breath spray kind of thing, or
Ah,
something
no,
like,
no,
or
no,
like an
no, no,
inhaler or
no.
something
Oh,
like that.
yes, good point. No, it's a spray on the skin. Yeah, yeah.
Don't know why I went there first.
No,
The most
why
uncommon
would
type
you?
thing.
Why would you? I mean, you could spray it anywhere, I suppose.
Okay, great. So, I mean, we've already talked a lot about the menopause, but I mean, I guess if you could just take us kind of through the menopause and arthritis,
Yeah,
and cover anything that you haven't covered yet in there.
definitely. So, this is such a common problem. So, at least 60% of women who go through the menopause complain of joint pains, and that's not usually listed top of the list of problems that women complain of, but it is a really, really common problem.
Mm,
So maybe 60-70% of women get hot flushes. So it's as common as hot flushes. And it's called menopausal arthralgia. Arthralgia meaning joint pain. And what women will typically describe is waking up in the morning and their hands are achy, or they don't feel as though they can make a strong fist, or especially they have aching around the bottoms of their thumbs when they grip it hurts, can't undo jars, that sort of thing. And it can be quite disabling. Some women are woken up by this in the night, and it can also affect the feet as well. So for lots of women, it can get confused with inflammatory arthritis, which sounds pretty similar, pain in the morning that generally kind of wears off. So lots of women will be having investigations for this with nothing much found. And it's often just due to this hormone thing that sneaks up. And if you ask a woman who's, I don't know, say 48 and may still be getting periods, but they might be a bit more irregular. And this may be a woman who's complaining of joint pain. What are your hormones doing? And they'll say, oh yeah, actually they are. Yeah, things are changing. Things are definitely changing. Then menopausal arthralgia is high up on the list of things that this could possibly be.
So, what are some of the things you think people should be looking out for? Because I mean, I know quite a lot of women who've been through menopause who
Yeah,
are on the cusp of it as well,
yeah,
and
yeah.
so one of the sort of complaints I've heard from so many of them is that, like, when you go to a doctor, they say it's one thing and another one says it's another thing. And because it presents in so many different ways,
Yeah,
how do you tell if that's what's happening?
yeah, it's a tricky one. It's a tricky one that sometimes. I think if anybody has got joint pain that is worse in the morning, especially if there is swelling and stiffness in the morning, it's really important to get that investigated to make sure that that is not inflammatory arthritis like rheumatoid arthritis, because that needs a different form of treatment. So it needs investigating. If all of those tests prove that there's nothing much going on, the blood tests are normal, or there's no abnormalities on an X-ray or a scan, then what you'd start to do is to sort of explore the possibilities that this could be hormonal. And if a woman is interested in starting some HRT, then I think that would be a good time to try that to see. And if it is menopausal arthralgia, chances are when you replace those hormones after about, it takes a while for them to work because they've been deteriorating for quite a long time, for several years. It can take a while for that to kick in, usually 3 months. You would try some HRT and see if that helps. And then what you do if it does help is you would continue that HRT. And then at some point, when you feel ready to try and reduce it potentially, there's no reason that you inevitably need to stop it. You can continue it if you wish, but you may well try to reduce that a little bit. And often it will have settled within a couple of years. So if you can't have HRT, menopausal arthralgia will usually settle by itself within a couple of years, but it can be a real pest.
Hmm. So another sort of question that's just come to my mind is if you have, say, osteoarthritis, for example, or I
Yeah.
mean, or any type of arthritis, we'll stick for osteo for now, though.
Yeah.
If you have this, say, pre-menopause, are you then likely to have worse issues after the menopause? Like what effect's that going to have on it? Right, excluding, not just inflammatory arthritis, but other
Yeah,
types as
no,
well.
not necessarily. So osteoarthritis is often diagnosed around the same time. It often starts in the 40s and 50s. So the two things often coincide.
Mm.
Osteoarthritis, we should say, is wear and tear, an age-related condition rather than inflammation. So it doesn't necessarily mean that if you've got a lot of menopausal pain that you're going to be worse afterwards. No, definitely not. It doesn't mean anything.
That's good then. Well, that's
Yeah.
good.
Yeah.
At least it's not going to get
Yeah.
necessarily worse from that.
No.
Let's take a trip post menopause now. So we're talking like older ages.
Okay. Yep.
What happens to our joints and bones then? Like, especially with and without arthritis, I suppose.
Yeah, absolutely. So we obviously add the ends of our bones aligned with cartilage, which protects them. That's the shock absorber. And obviously, as we go through life, the cartilage will sustain some knocks and falls. We'll fall over, we'll have accidents, we'll break bones. So the cartilage will sustain some damage. And sometimes that causes pain, and sometimes it does not, as all of our publicity will state. There is no correlation between the amount of damage on an X-ray and the amount of pain that people experience. However, there will be a natural deterioration in the cartilage as we get older, but that does not necessarily mean that we have to have pain. You will know all about this, that we've got to be looking after our diet, we've got to be exercising, we've got to be keeping our weight under control, and we've got to be keeping our mental health on the rails and making sure we're looking after ourselves properly to minimize the chance of us having pain, and looking after our sleep, of course, as well, which is vital in all things, really. In terms of our bone health in general, the other thing that is often overlooked is osteopenia or osteoporosis, which is loss of bone density. And we're talking mainly about women here, although this does also apply to men. 1 in 2 women over 50 will have what's called a fragility fracture, which is a broken bone after a fall from a standing height. So this should not happen. This is not normal. And so we all need to be now more aware of our bone health. We naturally lose bone density after the age of about 50, as again, it's an estrogen related thing. As the estrogen drops, our bone density will gradually drop year on year. And in some people, that will increase the risk of fragility fracture. So everybody over a certain age should be having a bone health assessment with a GP to check on their other risks, which include things like smoking and alcohol and other conditions.
Is that men and women? So
Men too, yes,
yeah.
men are also at risk of fragility fracture, less than with women, but the same also applies. So with age, men's bone density will also naturally decline.
Obviously, I'm assuming that there'll be, if you have arthritis, then things like osteoporosis are going to be an even bigger issue.
Yes, to some extent, that is a really good point. Now, two main types of arthritis differ in that regard. So, in osteoarthritis, which is wear and tear, there is actually new bone formation. So that there is a theory in particular that if we have new bone formed in our spine, which we often do get with osteoarthritis as we get older, then that reduces the risk of fracture in that area, which is kind of good news and bad news, if you like. However, people with inflammatory arthritis, so like rheumatoid arthritis or ankylosing spondylitis or similar conditions are definitely at increased risk of losing more bone density. So for them, having bone density scans is even more important.
Great. So obviously, as we very well, like you very clearly established, hormones are incredibly important, and like
Yeah.
having good regulation of them is. So is there anything like preventative that people can do? Like, is there a way to keep your hormones kind of on track and how they should be? I don't know if this is a ridiculous question or not,
I
but
don't know. My mum always said I'm a slave to my hormones. So it's
yeah,
hard to
can
know.
you harness them and make them do what you
Well,
want?
hormones are there to help us, aren't they? I mean, they regulate all sorts of things: our mood, our appetite, our sleep. I think what is important here is to optimize our general health here, especially things like our mental health, because our mental health has an effect on our hormones. We know for sure that women who are more anxious or more stressed will get more menopausal symptoms, and talking therapy can help with that because it calms all of that. Can really there's strong evidence base that talking therapy can help with hot flushes, for example, which, as I said earlier, can then improve sleep and that can improve pain. So, keeping our mental health under control is really important. Keeping our weight down is very important for hormonal regulation. Looking after our gut health is very important because the gut talks to all the rest of our body. So, it talks to our brain. The gut is also important in hormone regulation. The gut talks to our joints as well. So, making sure we have healthy gut bacteria is very important. And what that really means in terms of diet is trying to avoid too much, not avoid completely, of course, but avoiding too much things like sugar, too much processed foods, and increasing the amount of fiber in our diet. Broadly speaking, that's the way to go with this. And eating a healthy diet in terms of having a balanced diet, in terms of plenty of fruit and vegetables, pulses, Mediterranean type diet, which I'm sure everyone will already know about.
Yeah, if you do want to know more about that diet, we do have an episode on that as well, of course, plus
Yep,
loads of stuff on our
absolutely.
website. And
Yep.
also, I believe you did a webinar with us on arthritis in the gut, didn't you?
I did. Yes, absolutely. A very, very fascinating subject. Yes.
Yeah, so that can be
Mm.
found on our website as well.
Hmm.
So other thing you mentioned there actually was because obviously we advise keeping a healthy weight and like you're trying to make
Yep.
sure you're not carrying around too much
Yep.
extra while if you have arthritis. So as you mentioned that can have effect on your hormones as well. Could you tell us a little bit about what weight gain can do to hormones?
Yes, it's not very well understood. Now, there are some certain conditions, for example, polycystic ovaries, which is a condition of many, many women where the ovaries form cysts on them.
Hmm.
And that is related to being overweight, and that is related to a condition called insulin resistance. So we know there is and women with polycystic ovaries have all sorts of hormonal problems and often have problems conceiving because their estrogen cycles are all of the hormone cycles, in fact, are out of sync. So in those women, losing a significant amount of weight can dramatically improve fertility, for example, and can improve their insulin receptors. So we know there's a strong link there between being overweight and insulin insensitivity and again, sex hormones as well, estrogen in particular.
Okay. Final thing for you then. Any advice for people for any of those stages, or just for their hormones in general, rather than
Yeah,
yeah.
tricky, isn't it? I think you got to go with the flow. And I think if you're a man, what you must never ever do is mention to a woman that they might be hormonal because you'll get a smack in the face, probably. I think just being aware of it really is the main thing, and to know that our hormones are part of us, aren't they? And we have to kind of live with them and take the good with the bad. There will be good times when joints feel better, and chances are that's when the hormones are behaving themselves as well. So go with the good and don't get stressed about the bad.
Excellent. Love it. Thank you very much, Wendy. I really appreciate that. So, like I said, I've already mentioned we've got further detail on our websites, like the arthritis in the gut, our nutrition stuff as well. And there's loads of other things we've got on our website as well that have, plenty further reading if you want to know more about sort of like weight management, or you want to know about nutrition, exercise, all of these types of things to help keep you healthy and help, you know, do the best you can with what you've got. Please visit our website, which is www.arthritisaction.org.uk, and do feel free to send us an email if you have any questions, or if there's anything you'd like to hear on the podcast. You can send those to podcast@arthritisaction.org.uk. So amazing as always. Thank you so much, Wendy. I really appreciate it.
Thank you very much. That was great, Mark. Thank you.
Bye bye, everyone.